I thought I would take a minute just to explain how regenerative treatment works. But I think what we need to do is step back for a minute and ask ourselves, how does the body heal in the first place, regardless of what I do? There is a normal process that goes on. And so when you have an injury, the body normally will heal itself. So how does that happen? So this is supposed to be a diagram which represents a ligament here and a tendon here. Ligaments connect bone to bone, tendons connect muscle to bone. And this blue wavy stuff that should look like this over here on the far right is damaged, okay? And so what we're talking about is the blue wavy stuff is what we call collagen, okay? So when we have a sprained ankle, which is usually ligamentous, or we have, let's say, a rotator cuff, which is a tendon tear, you disrupt the fibers in this collagen, okay? Well, the first thing that happens is the body releases certain chemicals. We call them cytokines. And there's several different ones, but prostaglandins, interleukins, leukotrienes, there's a whole host of cytokines that are released, and that's a normal process. So what do? Well, they go and they dilate blood vessels, so you get swelling. They also come and innervate and irritate the nerve endings in the tendons and the ligaments, so you have pain. That's what inflammation is, right? But the third function that these cytokines do is they will run up to the immune system, flag it down, and say, hey, get down here and fix this thing. And so what happens is the immune system will migrate white blood cells into the damaged tissue. We're most concerned with the macrophages. And so they will go into this damaged tissue, and what they'll do is they will stimulate certain cells. So fibroblasts are cells that we have in every ligament and every tendon, and normally they're not turned on, but there are collagen factories. So when macrophages come into that damaged tissue, it stimulates fibroblasts to start laying down collagen, to kind of fill in this divot, if you will, okay? The other thing that macrophages do is they will stimulate some of your own local stem cells to come into this area as well. And these stem cells can differentiate. They can also help out the fibroblast. So the whole goal here is to get a damaged tissue better. And that's how the body will normally heal itself. Well, why doesn't it heal itself? People say, well, listen, I did everything right, but it just didn't heal. Well, there can be different reasons for that. You can have maybe the environment wasn't conducive to healing. Maybe you have a low hormonal status. Maybe your chemistries in your body are a little bit off. Maybe you keep having a repetitive injury. And then the one that I see a lot are anti-inflammatory medicines and steroids. Well, why is that? Well, if you think about it, anti-inflammatory medicines and steroids actually block this step here. So what would that do? Well, it will decrease the swelling, that's true, and it decreases the pain, that's also true, but it blocks the message to the immune system to come down here and heal. So you don't get the full healing effect. Okay, so a lot of people don't heal because of that. But again, it's a multifaceted reason why some people don't heal themselves. So what we do, well, let me back up for a minute. The whole process from start to finish, if you sprain an ankle, is usually about 3 months. Okay, you have the incident itself, you have cells migrate in there, you have laying down the collagen, and then the body takes that raw material and remodels it. You may feel better in 3 weeks, but the body's still working to try to get it just right to normalize that tissue. Here is an animation. It's on YouTube. Dr. Tom Raven and Gavin Maurer put this together. Tom Raven's done a lot of work from a regenerative standpoint and knows the mechanism inside and out. But I like this animation because it gives you a pictorial of what happens. And so here's, let's say, a ligament or a tendon, and it has some damage. So you injure yourself, all these chemicals are released, and they go up to the immune system, and the immune system migrates cells into that damaged tissue. Stem cells, in particular, will make new blood vessels. It will also turn on these fibroblasts we talked about to lay down collagen. So in essence, what you're doing is you're taking a frayed tendon or ligament, laying down the raw material, and then the body will take that and remodel it through time. So that's how the body normally heals itself. So all we're doing is we are taking this damaged tissue, let's say, and we are facilitating that same healing process, except we're going to inject something. And when we inject, that will trigger that response, and we just get out of the way and let the body heal itself. That's really all we're doing, okay? Whatever we put in this syringe right here is how we define the process. Whether I use prolotherapy or stem cells or PRP, the technique itself is the same. It's just what's in the syringe. So let's go through that. What do we inject in regenerative treatment? Well, prolotherapy is the chemical part of the solution, and it's really just a high concentrated dextrose, and it works osmotically. So you inject into that damaged tissue. Because of osmosis and because it disrupts membranes, that cascade is triggered. If I take a vial of your blood, I spin it down, I get really highly concentrated platelets and inject that back into this damaged tissue. We call that PRP, or platelet-rich plasma. It's stronger than prolotherapy. It's not always needed, but often it is. But it's very effective. There's also a product called an amniotic membrane allograft. It's really just collagen and growth factors, and one can get that through different medical supplies, and all that is a healthy mother, healthy infant, but just donated the placenta. And through an FDA purification process, they will just strip the amniotic membrane off and use that collagen to inject into tears and defects to help fill in the defect, and then the cells will hold on to that and will start replicating. If we look to the very far end of this slide, that is adult stem cells. And again, most of us in the orthopedic realm will use either bone marrow stem cells or fat stem cells. But the point is all of these products work by that same pathway, because there's really only one way that the body heals. It's just, where do we intercede along that pathway? And what do we need? If you have someone who has simple instability, often we'll just use prolotherapy. If you have someone who has a good-sized rotator cuff tear, we might use PRP, but we might also use some prolotherapy to strengthen some of those deeper ligaments. Sometimes people have really severe arthritis or maybe a little bit more aggressive tear, and we need to go all the way over to adult stem cells. So there's a variety of ways you can mix and match these. But again, the point is the technique is the same. It's just what you put in the syringe is how we define it.